On this episode, we will talk about if you are eligible for surgery, if you have high blood pressure and diabetes. We'll talk about the age range, lower and higher, to be eligible for weight loss surgery. And we'll talk about varicose veins. Does weight loss surgery prevent varicose veins? Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 209 of the AskDrA show. Thanks so much for being here and thank you so much for sending me your questions. Remember that if you want me to answer your questions, you're more than welcome to send them my way using the hashtag AskDrA throughout social media. That way we're able to grab those questions, add them here to the list. I'll be more than happy to be here and answer them for you. All right. Also, just to remind you, if you're into getting more knowledgeable into weight loss surgery, gastric sleeve, the content, tips and tricks, be sure to subscribe to our channel. That way you don't miss out on any of our future episodes. And at the end of the video, if you like our content, be sure to give me one of these because it's very, very useful. And thank you so much for supporting the channel. Let's get into the show. All right, so the first question is, the reason I added this question is very important because we get it a lot. All right, Dr. A, I have high blood pressure and I also have diabetes and I really want to know if I'm eligible for weight loss surgery, or because if I do have diabetes and high blood pressure makes me just not eligible because I'm a high risk patient. No. Here goes. If you have high blood pressure, you are eligible, and it actually is an indication to step forward and have weight loss surgery to help that high blood pressure. And the same goes with diabetes. So it could be together, having high blood pressure and diabetes, or just one or the other makes you eligible, makes you more eligible for weight loss surgery because you need to get those conditions under control and or make them go away, all right? By losing weight, help your body and eliminate the high blood pressure and or diabetes, all right? Second question is age range. And I know we've talked about this before, and just to throw it out there, ballpark figure, if you're 16 to 70 years old, you are eligible for weight loss surgery. Some exceptions apply. That means that not everybody from the age of 16 to 70 automatically are eligible for weight loss surgery. We, as bariatric surgeons, analyze each and one of the cases, and also goes for the lower end of the spectrum, 12 years old, 13 years old, 14 years old. I mean, teenagers. I mean, we've done as low as 10, 11 very severe cases of obesity with adolescents or teenagers having major medical conditions, high blood pressure, diabetes already, on several medications, psychological problems, and weight loss surgery is really a good option for these cases. Again, it is a very, very case-by-case scenario under the age of 16, and same goes over the age of 70. It is a case-by-case where we've done, at the time of surgery, our oldest patient 78 years of age. Again, you don't qualify right away if you're 74. No, I need to go over your health history. Why do you need weight loss surgery? If you're eligible at 74, then we analyze the case and we step forward. All right, I hope this helps. Again, 16 to 70 years of age. And the last question is, this is a very good one because we get it quite a bit. Does having weight loss surgery prevent me from having varicose veins? Because I have some already, and what's going to happen to them? Will they go away? And these are questions we get quite often. So, does it help you prevent varicose veins or venous insufficiency? The answer is yes. It will be preventive because once you lower the weight, once you lower the central part of obesity, you will have better blood flow from your legs, femoral, all the way back to your heart. And there's the blood flow, the return blood flow is way better. The venous system, all right? So, but what happens if you already have varicose veins? Well, those are there. Those will not disappear. It is important for you to understand. Actually, once you lose weight and once you lose the fat tissue underneath your skin, even in your legs, they may seem they're popping up a bit more because that is something that you've had, you developed, but it doesn't mean they got worse. It means that the skin got thinner because the fat tissue underneath it got thinner and they're popping up a bit more. But it doesn't mean that weight loss surgery is causing varicose veins. It means that you already had them, you've seen them already, and by making that layer a little thinner, they're popping up a bit more. But once you get weight loss surgery, it will help you prevent them from getting worse down the road because your circulation is going to be way better at a more or at a better weight. All right, so there you have it. That is it for episode 209 of the Ask Dr. A show. If you like the content, leave me one of these. I appreciate it. Thank you very much. Very useful and helpful for the show here. And thanks so much for the support. Again, send me your questions because if there's no questions, there's no show, and I'll be more than happy to be here to answer them for you. Remember, just to use the hashtag AskDrA throughout social media. And, well, thank you so much. I look forward to seeing you on the next episode. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.